A 40-year-old patient with a history of peptic ulcer disease was having abdominal pain since many days. It gets worse since last 2 hours. A radiograph was performed and shown. So in the question there was no issue. The question was a typical peptic ulcer disease, abdominal pain, and there was air under right dome of diaphragm. Now we know that this is a case of a perforation peritonitis. Now there is a lot of confusion in the choices that are there. Now some people have told me that it was a multiple completion type where the 5 choices were given and it was A plus B, A, B, C, A, B, C, A, B, C, D, E, etc., etc. So if you ask me if it's a perforation peritonitis, though it's become a more of a surgery question, so I'm waiting for Dr. Jay to give his opinion, but he's not well at this point of time, so it'll take a couple of days or 3 to give us much better answers from his understanding. But I feel that an IV fluid should be given to these patients. Now if it's a perforation peritonitis, you should plan an emergency laparotomy. There is always after the laparotomy, if observation is given in one of the choice, you should do an observation. Since it is already confirmed that there is a perforation peritonitis, I don't feel that CT has much role. In fact, ultrasound also does not have much role. So depending on how the question has been framed, if the choices are like this, I will go with this choice. But a lot of students have told me that these two were not there in one choice, it was a multiple completion type. Then one of the choice that they have told me is IV fluid plus emergency laparotomy plus observation, then I will say probably that would have been the best answer. So that's the biggest problem with the recall based question. You really do not know what was the exact question that was there in the paper, and that is why. So but what is the take home message is that you guys have to know that how does a radiograph of a perforation peritonitis look like. You need to know about the signs of the perforation peritonitis on a radiograph, and you need to know the management of perforation peritonitis in detail, so that in your NEET exam, if such question is asked, you are able to do that. That is the whole idea about doing the recall questions.